Hello, I'm Danny West. Welcome back to another episode of The Soapbox, your patient education station. And being that it is the second week of the month, we are chatting anatomy. And the theme for this month is the spine. So jumping right to it, if we look at the bony anatomy of the spine, we have our pelvis here, okay? We'll get more into that when we do the hip. But we have our tailbone here, which is essentially a triangle bone. The technical term for it is the sacrum. And then the tip of the sacrum is called your coccyx. Okay, but a lot of people will clump this into one name. They'll call that their tailbone. But just know it is two bones, the sacrum and the coccyx. Moving right along to the vertebral column, we have three sections of the spine. Okay. And they look a little differently as we look through all the vertebrae or all the Lego blocks of the spine because they're designed for different things. So if we look at the lowest part, kind of working our way up, this lower section of the spine, the low back, is called your lumbar spine. There are 5 lumbar vertebrae. So if we count here, we have 5, 4, 3, 2, 1. Okay, so these are your lumbar vertebrae. They are thick by design, and if we kind of spin it, you can kind of see that they have little anteater noses on the back of them. So those are kind of the bony little bumps you can feel in the center. And the lumbar spine, they're kind of anteater nose, kind of stubby, okay, like almost like an old man nose or something. So they're stubbier, designed a little bit different. They're thick because you got to think your center of gravity, a lot of your weight is kind of going through the lumbar spine and into the pelvis. So the lumbar spine is made for stability, not necessarily mobility, okay? And that's gonna change as we work up into the spine. And then the natural curve of the low back is what we would call lordotic, okay? So we do want a little bit of this curvature here. And I know for me, like growing up training, I thought neutral spine meant flat back, but it doesn't. We actually want to honor the natural curves of the spine, and that's technically a neutral spine. So the lumbar spine starts to go like this. We start to change curvature in the mid part of the spine, and then the neck or the upper part of the spine matches the same type of curvature as the low back, okay? And we want to honor that, and that is technically neutral spine. If we work our way up into the middle section, this is our thoracic spine, or in clinic, we'd call it like our T-spine. Notice that our Lego blocks are getting smaller, okay? And our anteater noses are angling down more, okay? And the unique thing about the thoracic spine is, yes, it adds a little bit more mobility than the low back, but the neat thing about the thoracic spine is it has a rib attachment, okay? So that's one of the main functions of the thoracic spine is that's where the ribs kind of click on there. So again, a little bit of a different shape. There are quite a few more vertebrae involved in this family. This is our thoracic, and there are 12 of them. Okay, so starting with our last lumbar, so L1 here, we would count 12. So we have T12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, so that whole midsection is our thoracic spine. And then again, it would have a different curve in the opposite direction, okay, this way. That's called a kyphotic curve. And again, we want a little bit of that kyphotic curvature to achieve a neutral spine. And then working our way up, the last segment of the spine, notice how tiny these guys are, okay? And they're even like, the platforms are almost like U-shaped, okay? We call these like a U-joint. But there's 7 of them. 7 cervical, okay? Or cervical, but cervical spine has 7, and so we count 7, 5, 4, 3, 2, 1, okay? And again, they're small because this section is designed, like contrary to the lumbar, designed for mobility, not stability. Okay, so if we turn them around, also shaped a little bit differently at each level. Those little anteater noses are tinier, but the Lego blocks, all in all, are smaller to allow for a lot of mobility in through the neck. especially these top two vertebrae, okay, C1 and C2, and they're primarily responsible for rotation of the skull, but know that that's also a job distributed down in through the cervical spine, okay? And then right on the top this is the base of our skull, and it basically sits kind of on C1. It's almost like C1's like a little bowl, and it's like a globe that sits like right on the bowl, okay? So it's not like a flat surface, it's a round surface. And again, going back to the curvatures, this is gonna have that lordotic curve, much like the lumbar, okay? We want a bit of that curve. Now, the big kind of cheats that I'll see in through the neck, or poor neck mechanics, are usually due to kind of slumped or protracted shoulders and this chin poking posture. Okay, so what that's doing is it's really tightening up right up through C1, 2, and there's little muscles there, or suboccipitals, that attach to our skull, and those get crazy tight in people, crazy tight. So I actually have to reteach people to do like the retraction or make a double chin, okay? Because that's gonna lengthen out the back where C1 and C2 are and kind of like realign them a little bit better. But if that gets so tight, I find that these muscles tighten up and they're one of the major headache causers. So if you find you get a lot of headaches, just see if you're doing this chin pokey posture, and it's like you're sending your chin back through your throat, okay? And what that's gonna do, it's gonna stack my ear to be in line with my shoulder. But for normal posture, people usually fall into this. So slump shoulders, chin jetting posture, we actually want to not just fix the shoulders, but send the chin back through the throat to again allow that C1, C2 to be sitting properly and allow proper mobility of the neck. So again, that was a really quick kind of bony anatomy of the spine. We'll kind of get more into musculature next week. Really exciting. We're gonna chat more about the core muscles, and I'm gonna show you guys them on ultrasound. So you can see a picture of somebody contracting their core muscles, and it's a super awesome tool that we use in clinic to actually measure the thickness of those core muscles to see how people are strengthening them and if one side is maybe stronger or more atrophied than the other. So yeah, tune in next week. We are doing a clinical look at applying some spinal anatomy. And last thing before we go is a little review. I've already done an episode on this, so definitely check it out, called The Core is Not Abs. A little bit of a myth buster episode. There are 4 main muscles of the core. The first one is your diaphragm. Okay, so kind of sits right on top. The bottom part, pelvic floor muscles, okay? Those need to work together with the diaphragm. So that's the top, the roof, and then the bottom part of the core, or our flooring, our floorboards, is our pelvic floor, or our stop the P muscles. And then in the front, kind of like that wraps all the way around the back, is our deepest abdominal muscle, not the ones that we like to like pooch out and show off at the beach. The deep ones is your transverse abdominus, and think of that as like a corset, okay, a really deep corset. We'll call them like TAs, and so we'll watch that on ultrasound and see how they can contract. And then one of the most like important ones as well, the last one is multifidus. And you can see between each of these Lego blocks, there are little intersegmental muscles. They're super deep. You can't totally feel them. Like if you get a sore back or you're working like power muscles, the bigger muscles of the back. Again, not talking about those ones. I'm talking about the super, super deep ones. Okay, and again, they're gonna kind of go intersegmentally between each of the vertebrae, and they sit really close to the spine. So those deep ones, well, all of these are deep muscles. They're deep stabilizers. They're not power muscles, but it's kind of like building a house. you don't just go and build the siding and jump right into it. You got to build a framework first to support the structure of the house and give it the best integrity. So if we don't have our framework built and strongly developed, it predisposes us to injury because, again, that deep intersegmental stability isn't there, okay? So we need that foundation of our core house, or our powerhouse, as Joseph Pilates would say. So these little intersegmental muscles, one of them in particular, one muscle group, is called your multifidus, okay? So we have multifidus in the back. We have TA that wraps kind of around the front. We have diaphragm, and then we have our pelvic floor. So that essentially makes up this little cube, this three-dimensional cube of stability. That's why breathing is also so important, because diaphragm is one of the core muscles. So we're gonna actually look at those on ultrasound next week. It's super cool. Gonna geek out even more than I am now. But these are the deep ones that we're gonna look at and that are so crucial in conditioning to prevent injury. So tune in next week. We're gonna geek out in the clinic with one of my dancer friends and apprentice, Miss Tamara. So definitely tune in for that if you really wanna get more of a visual cue of what's going on in the core muscles, because they are hard to feel. And I find that if people don't feel something during an exercise, they think it's not doing anything. And the core is quite the contrary. It's the deep, subtle stabilizers, not the big, loud power muscles that are on the outside. So yeah, so anyways, thanks so much guys for tuning in. That's your bony anatomy and core muscles of the spine, and we will see you next week. Thanks so much.